Hello and welcome to this webinar on the Mental Health Act 2025. My name is Elizabeth Cleaver. I'm a barrister at Doughty Street Chambers. My areas of specialism are mental health, court of protection and inquests. And today I'm going to take you through some of the key changes brought in by the Mental Health Act 2025, which provisions are currently in force, and what further changes we can expect to see as this really important piece of legislation is gradually implemented. So what we will cover today, so very briefly, the background to the reforms. How did we get here in terms of the Act? I will talk briefly about the provisions that are already in force, as some of these came into effect on the 18th of February 2026. I will talk a bit about the next steps for this legislation and the reminder of main changes that the Act is going to bring in and those that are yet to be brought into force. So first of all, a bit of a reminder to the background. So this piece of legislation has been quite some time coming. Greatest reforms in over 40 years. So we had an independent review of the Mental Health Act, known as the Wesley Review, which was completed as far back as 2018. The final report was published in December 2018. And the Commission, who were asked to look specifically at our mental health laws, were asked some specific questions. First of those being, why are there rising numbers of people being detained under the Mental Health Act? Secondly, why is there a disproportionate number of people from Black, Asian, and ethnic minority groups being detained under the Act? So the review undertook a really large piece of work in looking back over the legislation and made 154 recommendations. Those recommendations were first brought together under a white paper. So the bill was announced first in 2021. That was shelved by the last government, unfortunately, due to lack of parliamentary time. And the bill was then reintroduced with very few amendments back in November 2024.